Did you know, according to the Department of Veterans Affairs, about 20 veterans die by suicide every day? Post-traumatic stress disorder, or PTSD, affects about 1 in 10 Afghanistan veterans and as many as 1 in 5 Iraq War veterans. Although many veterans reintegrate back into civilian life without any problems, many don't, and barriers to access can make getting the care they need more difficult than it has to be. You know what they say, a picture is worth 1,000 words. At the New Orleans Veterans Medical Center at 2400 Canal Street, there's a special photo exhibit called Faces of VA that features veterans who are patients of the VA healthcare system. We'll share some of those photos and the stories behind them in our Community Health Heroes Report. U.S. Army veteran Stephen Lasserre was a part of the 4th Infantry Division and one of the first combat troops sent to Vietnam in 1966. He got wounded and received a Purple Heart and a Bronze Star. Stephen and his wife Priscilla live in Lafourche Parish and have both been volunteering at the Southeast Louisiana Veterans Healthcare System for more than 22 years. Lasserre is being honored again for his service in a photo exhibit called Faces of VA, where he gets to share his story about his mental health rehab.
The mental health struggle that I faced, it was real bad. My brain wasn't working right. And I used to have suicidal thoughts and everything, and I couldn't keep a job. I couldn't talk to anybody. You know, I had to be alone, and it was very hard on me.
Mr. Lasserre represents the lion's share of our patients, in that most of our patients are Vietnam-era patients. When those men and women returned home, many of them came with post-traumatic stress disorder. In those days, we didn't even really understand, in healthcare, in medicine, we really didn't even understand what those symptoms represented. We've come a long way. The VA has led the way in best treatments for post-traumatic stress disorder.
Medical Center Director Rivera said the Southeast Louisiana Veterans Healthcare System provides primary, specialty, and mental health care to veteran patients like these throughout 23 parishes in Southeast Louisiana. He said the whole VA system takes care of 10 million veterans, and a third of weekly visits are by veterans seeking mental health services. Faces of VA is currently on display through Friday, May 28th in the public areas of the Veterans Medical Center at 2400 Canal Street in New Orleans. It features veterans who are patients of the VA healthcare system sharing their stories. Lasserre said he sought treatment decades after his service in Vietnam, and he credits the VA's psychiatric and group therapies for bringing him back to life.
Well, I'm hoping to get the message that this facility here and the people here is ready and able to help them out with any need they got. That's the number one thing I realized when they're reading those pictures and everything. They see what we went through, and they know that they can get the help over here that they need.
It's wonderful to see our patients, our veterans, our nation's heroes, explaining to us what our services mean to them on a personal level, for their health care, for their overall quality of life, and for their willingness to live a fulfilling life. These pictures that you see represent, in many ways, evidence of that experience. Mr. Lasserre has been, is a really clear example of someone who has stayed with the VA and has continued to thrive and has continued to enjoy life and be successful in life, but all throughout always connected to his VA healthcare system, his doctors, his nurses, his medical center here in New Orleans.
You see I'm laughing? Happiness. Before that, I wouldn't smile or nothing, but now I can smile back. They brought me back.